Hello, everyone. Welcome to the webinar. My name's Eliana Monteforte. I'm the coordinator of the Civil Society Engagement Mechanism for UHC 2030. We are here co-hosting this webinar with the World Bank. I have about 5 minutes to do a quick introduction. I just want to talk a little bit about what the UHC 2030 initiative is and how the CSEM, the Civil Society Engagement Mechanism, fits into it. UHC 2030 provides a multi-stakeholder platform to promote collaborative working in countries and globally on health system strengthening. They advocate to increase political commitment to universal health coverage and facilitate accountability and knowledge sharing. Now, as part of the UHC 2030 initiative, there's a civil society arm, which is the Civil Society Engagement Mechanism, also known as CSEM or CSEM. Our role is to elevate civil society voices in the UHC 2030 initiative to ensure that UHC policies are inclusive and equitable, and that systematic attention is given to the most marginalized and vulnerable populations so that no one's left behind. So the UHC 2030 initiative is hosted by both the World Bank and the World Health Organization, and we're collaborating today to bring you this great presentation on the G20 Health Financing Report. So with that, I will give the floor to our moderator, Anu. Anu, can you just do a little introduction of yourself, and then we'll have Christoph introduce himself, and then we can begin.
Sure, thanks, Eliana. Hello, everyone. Thank you so much for joining us this morning or afternoon or evening, wherever you are. My name is Anu Palan. I'm the communications lead for the Health, Nutrition, and Population Global Practice here at the bank. And I have also been working closely with UHC 2030 since its inception on advocacy and communications. So it's really, really exciting to be here at this point today, because many of you have been working with us in the process that has led up to here. So maybe what I can do is hand off to Christoph to introduce himself. He's the lead author of the report. And then I'll just provide a little bit of context for where we are.
Yes, and yeah. Sorry to interrupt you, Christoph. I do want to say that the first half of this webinar is going to be Christoph's presentation, and then the second half of the webinar will allow for question and answers. You can raise your hand if you have a question, and then I can unmute you in the second half so you can ask your question, or you can type it in the chat. I will be monitoring that. So please hold your questions until the presentation's over, and then we'll spend the second half answering them. Thank you, Christoph. Go ahead.
Yeah, sure. Also from my end, good morning, good afternoon, good evening, wherever you are. Very welcome to this joint session. We're really excited to have this conversation. This is it's in the midst of consultation on this report. Anna will say in a few words a bit more about the process, but just want to introduce myself. I'm heading the health financing work for the World Bank Group for the last 4 years, and we're very excited about the collaboration we had over the last 2 years with Japan, in particular on financing UHC, but more about that from Anu quickly.
Thank you, Christoph. So Eliana, if it's okay, we can kick off the quick introduction, and then Christoph will do will walk through the presentation about the report itself.
That sounds great. Okay? Yes, go ahead.
So just to provide a little bit of context, as many of you know, you have all been involved with the drive to really build political momentum behind the whole idea of universal health coverage. And the very first UHC day, which actually the bank also did join, was back in 2014. And many of you, as part of the UHC coalition and in other ways, really helped build the political momentum around this idea of universal health coverage, and that being an overarching theme around what the health sector could organize. And so this has also been a core focus of the bank's own work. It is the organizing principle around all of our investments and also our technical work. And so in the course of this, we had been working with a whole range of donors and stakeholders to push forward this momentum, as well as, of course, with WHO. Many of you were also at the UHC Forum in Japan in December of 2017. And so the idea for this really started there, where we had a broad base of stakeholders. We had the second global monitoring report, which really revealed the extent of the problem. And we then started to have this conversation with Japan and other stakeholders, but especially Japan, about how we could continue to build the political momentum and the spotlight on the issue, but also to then see what the World Bank could bring uniquely to this from a financing perspective. So coming out of that forum, we had an open event here at the World Bank Spring Meetings last year, about a year ago exactly. And at that, again, we had a lot of countries come forward at the highest levels, finance ministers, heads of state, former heads of state. We had a deputy prime minister as well, and they really spotlighted the issue. They raised why it was important not just for health outcomes, but also for their economies. And it was very clear that there was a level of commitment to this, a level of worry about what would happen if we didn't urgently solve some of the issues, especially around financial protection for individuals. But also the fact that the way that we were financing health systems is not sustainable. So this was a piece of work that we wanted to take forward in some way. And that is kind of the genesis of this particular report, which Christoph will walk through in terms of the health financing. But Japan then decided to, or agreed to, put this on the global agenda for the G20 during their presidency. And so Japan has taken on the presidency starting in December. And in June of this year, there will be the G20 Summit at the end of June. One thing that we discussed and what makes this difference is that this is universal health coverage is not being discussed just in the health track anymore. There's always been a health ministers meeting around the G20. There was one in Argentina last year as well. But what's new in this presidency, thanks to Japan, is that it's been put on the finance ministers track and discussion. So the report that's being produced is going to inform the finance ministers meeting, which is in early June. And there will also be a special session of health and finance ministers on the margins of the actual G20 Leaders Summit at the end of June. And so the idea with this in terms of political visibility is really to escalate this issue to health financing to not just, again, it is about good health, but it's also an economic issue that the whole of government needs to pay attention to. So that's a little bit the context for it. I'll just say a few words about the level of consultation that we're really trying to do, because we think, obviously, there's a big community behind this. And in the course of developing this report, we have been able to talk to over 15 country executive directors. The way the bank is set up is that our governance is the executive directors of our board, and they all represent countries. And so we have been able to go and meet with those country representatives to make sure that all the G20 countries, as well as countries that are being invited to attend the G20 by Japan this year, they're all fully informed that they're on board, that we're taking on board their feedback and their suggestions as we develop the report. And we have also done a range of consultations with other partners, with UNICEF, OECD, the Gates Foundation, WHO, of course, we're actually doing that today, with the IMF, with the Asian Development Bank, with Gavi and the Global Fund so far. And of course, this is our first civil society engagement, so very excited to be doing this. And we also hope to do one around the spring meetings in person with those of you who are here or colleagues who will be here. And finally, we are working also with UHC 2030 to do a private sector round of consultations as well through the WEF. So I'll stop there, and then I'll hand it to Christoph, who can maybe speak a little bit to the timeline for the report itself, and then walk through the key messages of the report.
Good, thanks so much, Anu. Just a couple of additions quickly on the process. First, this is a new initiative under the financing track. So it's the first time that this happens, that health will be discussed among ministers of finance in the G20. So we're really grateful for Japan to take the initiative on this. Now, having said this, the G20 under this track and all tracks operates by consensus. So any new initiative has to be agreed by all G20 member states. This happened in January. There was the first finance deputies meeting in Tokyo, followed by the Sherpa meetings, the so-called Sherpa, the leader track of the G20, and they had to endorse the initiative. So we were very excited that this passed this first step, but I think it's very important also in terms of the content of the report to bear in mind this is a consensus-based process. And what we're really aiming to with this report is to generate momentum among the ministers of finance of the G20 to keep UHC in the financing track discussion over the years beyond this, beyond the Tokyo summit. And right now we have some indications that Saudi Arabia, for example, that takes over the presidency, and some other members of the G20 are interested in doing so. So that we're very excited about this prospect. I think, it's very important to bear in mind this is the consensus mechanism of the G20 member countries. And the other point I wanted to quickly highlight is that the report is referred to as the reference report for the discussion. In parallel, the Japanese Minister of Finance is developing a so-called shared understanding document. This will be a very short document, probably a couple or 3 pages, that presents some kind of principles in health financing, among which the G20 member agree that there's some kind of consensus around those principles. And this is the key document that will also then feed into the declaration of the summit. We had a very good conversation with the Japanese around this, so that the report and this shared understanding document are in sync and supporting and reinforcing each other. And my final point is just this year, the summit is very, very early. Normally it's in October or November of a year. Then we got only the green light at the end of January, so it's a really compressed agenda. And the first report will be the first version of the report, and the shared understanding document will be discussed on April 10, 11 on the sidelines of the spring meetings. Here in DC, the G20 Ministers of Finance will meet for 2 days, and that's for the first time that UHC financing will be on the agenda. So bearing this all in mind, let me quickly talk you through the kind of outline that emerged over the last 6 months into many consultations, even prior to those now on the outline itself, with many of the stakeholders in G20, when we got a sense of what kind of messages would fly. The first one was really the idea of making the case again for investing in health and putting together what is new about this argument. We know what is new about this, but also better understanding why many ministers of finance in lower income countries agree that health is a good investment, but still don't invest. There's a lag between this kind of consensus and actually the action that we see. So what we do is 2 things that we try to stress. The first one is that there are immediate benefits. Often investing in human capital is seen as a long-term investment outside the business cycle, but we stress that there are immediate benefits when you focus on productivity of the workforce. The second one, which is fairly new, is really something that we really learned over the last decade, but is not so prominent, is really the impact that health financing for UHC can have on poverty reduction, but also on income redistribution and building a middle class that is taxable, increases the taxable capacity of a society, so can create some kind of a virtuous cycle of investing in health. And finally, what's very important is that financing for UHC can really drive efficiency in the sector, most importantly in terms of investing in frontline services, and can contribute to fiscal discipline, which is also of a high importance for ministers of finance. And finally, and that's where a lot of the global interest in the G20 rests, is the health security argument. That investment in UHC, in frontline service, actually sets the stage for preparedness at any country in the world. So this is the first argument we're trying to make. Then we move into an argument that this prospect of UHC financing for inclusive and sustainable growth is an unfulfilled promise in many countries. And you see some data that we pulled together. The first point that we try to make is it's a large industry. The healthcare industry actually is the largest industry in the world. It's constituting roughly 10.5% of global GDP and creating 60 million formal jobs, 70% those for women. These are very important arguments, and we saw that in the conversations up front with finance deputies, that this is an important point to remind them. It's an engine of growth in many countries. But then the unfulfilled promise, and you know this probably from our work on domestic resource and use and mobilization, the so-called drum agenda. In too many countries, we see a convergence among 4 key points. The first one is inadequacy or insufficiency of government investment. You see the numbers there. We update them now for 2016. But in low-income countries, domestically raised government financing still around $7 per capita. In lower middle-income countries, around 25. That leads to the facts that you're well aware of, that 100 million people are impoverished every year because of high out-of-pocket expenditures, and 800 million face catastrophic expenditures. A point that we cast more carefully than in the report than it is here is the issue about waste in the health sector. Roughly 20% is a larger agreement right now, also in OECD countries. And this is an important point to make, that is the same across other sectors. But in health, we know fairly well what the low-hanging fruits are and how we can have tangible improvements in improving efficiency in the sector. And finally, a very important point is in equity, and in the report we will show much more dramatically than here how different the levels of spending are by income class, by rural versus urban populations, as well as by different financing schemes in countries. Now, from this argument of an unfulfilled promise, and here is where we try to bring the G20 countries into the conversation and the policy issues that they face, is the issue that developing countries must also prepare their systems for the future. And we talk them through the threats to the sustainability of their systems. One is those threats to cost that drive up cost pressures, the NCD burden, aging, technology, but simply also the expectations of societies in terms of the standards of care and the benefits package that are available. Then I think a very important point that we do, and we are in consultation with this also about the IMF, but if you look at all the data that we have available, and we demonstrate this in some simulations, is that the capacity for countries to raise more financing for health and more generally for public expenditures is likely to be stagnant. So there is overall less room there, and that has many issues. We see different growth patterns today, the slow formalization of the economy, the taxable capacity remains limited. So there's some reasons to assume that the gap is growing expectations in terms of UHC and the fiscal capacities of governments. The gap is actually widening, and the uphill battle gets steeper and steeper for countries. And then there's an important point to make about the economic shocks and pandemics, but also migration surges and antimicrobial resistance from a global perspective, very important points to raise in terms of investing in health. Now from that, we move in the report into a country-led agenda where we make recommendations. And there are 4 basically important points to make. The first one is scaling what works. And we demonstrate this on a list of policies where we know that there's a broad agreement on the principles and the policies, but countries lag behind in their implementation. You see in the PowerPoint some of those examples, but one that's very important, for example, is the investment frontline. So it's simply a political decision. We know how it works. We know that's a good investment. It's just not happening. Just looked yesterday at some new data on the investments in primary healthcare, and they're far too small in most of the lower middle income countries. So from there, then going beyond scaling what works, the point we pick up is that these systems have to be future-proof in the 21st century. key elements there are the pandemic preparedness, but we also really want to stress the point of a whole in government budgeting approach. And it's not enough only to look at the sector, and the sector competes with other sectors in a zero-sum game for budget. We have to go beyond this also in the advocacy and take a broader perspective on this. And health can actually lead the way there. And from this kind of work on the resilience, we move them into a couple of points on how we can accelerate innovations. And I think you will see this in the report. We will show simulations again that simply, if even under the best growth and fiscal policy assumptions, many countries will not get close to the $90 target of spending in low-income countries by 2030. There will be still, I don't want to tell you a wrong number here, but right now we're estimating still a gap of $100 billion by 2030, just for the poorest countries to reach the $90 spending target. Compared to $30 billion of DAH, currently on average there will be a $70 billion gap still in 2030. That means we will leave many people behind. And so we have to think also differently and think about different ways beyond just getting what works, what we can do. And here are a few examples. But what we think, for example, is very promising. Out-of-pocket expenditure in the developing world are $600 billion annually. If we manage to pool even a quarter of those, $150 billion, this will be 5 times more than development assistance for health. So what are the new inroads that we can have in terms of mobilizing a resource from those with the ability to pay, to contribute to pool prepaid and pooled financing? So there are some kind of grand challenges out there. And this overall digitization that comes with these kind of attempts that we're currently seeing in these inroads also opens up the doors to completely different ways of generating information, improving transparency and accountability in the sector, and informing policy design. Our final point on the country agenda is very simple. It needs more leadership, it needs better governance, and it needs better organization capacities in more countries in health financing, something that we believe has been also a blind spot of development assistance for health until today. So what can the global community do about this? We think in the first place we need to measure and build an accountability framework for global progress towards financing UHC and closing the gap. This has to, in our view, there are good initiatives right now under the African Union, the tracker, to look at this, but we need a global mechanism within the global action plan on health financing. The second one is we need some kind of learning to resolve some of the controversies that still persist in many of the policy areas on health financing. But as indicated earlier, we really have to start looking into innovations. Again, business as usual will not take us in terms of financing UHC to this goal by 2030. And finally, we have to also think about how to make these systems fit for the future. So how can they deal with the future challenges, and how do you build this into the financing strategies, into the policy design? And finally, we make a couple of points on development assistance. We propose to move towards a new generation of development assistance for health. The first one is really about how can we close that big financing gap. And a couple of thoughts there are most important. The first one is how can we really use DAH better to build the leadership, the organization capacity, and the governance for health financing to strengthen domestic resource mobilization. And second, we have to think more about how we structure DAH that it really starts mobilizing and catalyzing domestic resource mobilization rather than crowding it out. There's some promising inroads, but there's much more to be done on this agenda. And finally, there's an agenda around the global health security that we have to further strengthen the global financing architecture for health security, that it responds faster and more effective. I think the current situation in DRC is testimony that we have some way to go to strengthen this. So again, this is in the 10-minute version, I think, of the report. As as we're drafting it right now, we hope to have a next draft for further consultations, in particular with the Japanese government next week, and then the draft will go out to the finance deputies on April 5. Sorry for this. Back to you then.
So it looks like we actually have a question in the chat. Anu, do you mind if I just read it out loud, because it was actually sent to me privately?
Sure, of course. Go ahead.
Okay. So what role should sub-Saharan civil society play in attracting the attention of the G20 members at their next meeting in Japan in order to mobilize the political and financial support needed to meet the deadline for the CSEC in 2040 and more broadly? This is from Iselmu. Sorry if I mispronounced it.
So that's,
yep,
yeah.
Go ahead.
And can I raise one question? First, maybe I can throw that to Christoph, and then I'll try to answer the question that you just raised. Is that okay?
Sounds great.
I think, Christoph, it would be helpful also to hear why we think the G20 is a good venue to have this conversation, and sort of what is the opportunity there because a lot of the focus is on developing countries, but many of the arguments also work for countries across the spectrum. So if you could speak to that, I will then I'll follow up with the answer.
Yes, thanks, Anna. I think that's a very good point. And an obvious question when you think about G20, the largest economies in the world, why would you raise, in particular, the situation in developing countries with them? First of all, I think that the focus on development countries is not the only one of the report. Again, we really try to look also to look into the emerging challenges that prevail in G20 countries and look for common agenda across countries. And we think also there is a joint learning agenda on key issues. Like, for example, let me just explain on this point. We see slow formalization in all lower income countries right now, 4.5% in 25 years. That means the old health financing models will not work. But at the same time, we see the gig economy, automation in high income countries leading to the same effect. So there's a joint learning agenda. The second big argument is the G20 was born out of the South Asian financial crisis. So this is really a crisis policy club that debates how to prevent them in the future. And we feel strongly that if we don't tackle this kind of health financing crisis in most developing countries, there will be large ramifications also at the global level. And that particularly links back to those threats that we discussed in the report in terms of pandemics. We talk about migration surges. It's for the overall sustainability and human security agenda. It's a very important argument. And finally, the G20 donors will be key in the replenishment of the global health funds that are up in the next couple of years. So we think there's also an important role that they can play in terms of shaping that new generation of development assistance for health.
That's great. Thank you, Christoph. Eliana, is it okay if I try and answer to the question that you just threw out?
That sounds great. Go ahead.
So thank you very much for that question. And we're actually very, very excited at the possibility of what we could do jointly in terms of raising the awareness and the focus of ministers and kind of the whole of government in developing countries. And you raised specifically about sub-Saharan Africa. I'll take a little bit of a step back. You might be aware that the World Bank launched the Human Capital Project last year in October at the annual meeting. And that includes an index which basically measures health and education outcomes and looks at countries and how well they're doing on those outcomes. And the point of doing that really is to raise the political pressure on governments to increase their both the amounts that they're investing in human development, but more importantly, the outcomes, how they're spending the money and how their people are actually doing, the people in the country, in terms of their health and education and their preparedness for jobs of the future. And the reason I raise this is that what we found coming out of that is that 25 out of the 30 countries that were at the bottom of the Human Capital Index are from Africa, and mainly from sub-Saharan Africa. And so this really increased the political pressure on governments once this came out, because we found not just the conversation on these issues go up among leaders. We found an unprecedented level of interest from finance ministers then turning to the World Bank and saying, well, you put out this index, we see that the results are not good. What can be, right? So we do think that there is a very fertile and a kind of open mind and a level of awareness that this has generated, which we hope that this report will then take forward in the health space. We have more than 20 sub-Saharan African countries that are working with the World Bank right now to figure out plans for how they increase their investment in health and education. Of course, health is one sphere of human development, but we do think this really opens the door in terms of the political engagement on this issue. So we would love to figure out how you as civil society can help take that conversation forward at the country level. Because, often ministers will come here and, we have a certain conversation at the level here, but if we are not then following up and working with the affected communities and or civil society in country, then the accountability only goes so far. There's a level of global accountability that's important, but the local one is more important. So I think what we would love to be able to do ideally is, in the context of this report, as well as the Human Capital Project, work more systematically with civil society in terms of, maybe in a few countries where there's agreement or where there's interest, we could think about activities within the UHC 2030 umbrella that are joint advocacy activities. And this could be, events, it could be placing of op-eds, it could be many different things. We could specifically maybe do something in June, we were thinking, in the lead up to the G20 as well, in terms of continuing the pressure. And then we have other global moments, which are important, like the September universal health coverage focus at the UN General Assembly. But then we could also tie that with the more local or national calendars, whether it's elections or other moments when it makes sense to raise these issues. So if there's a way to continue that kind of conversation within CSEM and for some kind of joint engagement or activities, that would be really helpful from our perspective. I don't know if you wanted to add something, Chris, after that.
Good. No, interesting.
Great, thanks. I will open up the floor to anybody else who might have a question. You can raise your hand, or you can unmute yourself, or I can unmute you. Or you can always type your question in the chat. So does anybody else have any other questions about the presentation or the context or any of the questions that have already been answered?
Hi there, it's Laura from Results UK. I think that was a great presentation, and there's so much data in there which is going to be useful for advocacy, as you say, both at that global and national level. I wonder if you could speak a little bit about how receptive any of the kind of the G20 partners have been already, or the executive directors you said you engaged with. It would just be useful, for example, from a UK perspective, if you've heard anything from that, because I think all as health advocates here and health economists, this all sounds great, and it's just for us now to work out how to drive that political buy-in as well.
Great, thank you. Go ahead.
So it wasn't entirely clear on this end, Eliana, or we couldn't hear your name either, so I'm sorry about that. Is there a way to...
Sorry, Laura, can you say that again?
Yes, sorry. So it's Laura. I work for an advocacy organisation called Results UK, based in London. Yeah. I just wondered about what reactions you've had so far to some of this research from either the World Bank EDs or from the G20 members themselves. From all of us, definitely sounds like it's fantastic data, really useful. But just wondering about other sectors' reactions so far as well.
Yeah, so briefly again, we have been discussing this with countries and country representatives through our D's office. In general, the feedback was positive throughout. I think let me say it this way, some countries are really enthusiastic about the agenda. For example, Saudi Arabia, we were very pleased to see this, given that they take over the presidency from Japan. We had very positive feedback and interest from South Africa, from China, and a few other countries. And I think what was also important for us to see in this kind of conversation is that there's no strong opposition, which we were honestly afraid of some of the countries, given their national health policy dialogue around universal health coverage. So I think that was really the positive surprise. So what we see right now emerging is that there is an agenda on, let's say, 10, 12 principles on financing UHC that the G20 members widely endorse, and this is captured in the shared understanding document. So while we're feeling our way forward into this conversation with the G20, given this a lot of political sensitivities around some of the issues of the UHC 20 agenda, of the UHC agenda, we're actually very, very excited that there's a way forward in the financing track. And again, for us, success at the Leaders Summit would be if there's an endorsement not only of the shared understanding document, but there is a commitment to continue this conversation in the financing track. So I hope that answers your question. Specifically on the UK, we had a very Chatham House type of conversation with them, and I think the UK was particularly interested in ideas about how we can, in the context of the Global Action Plan, also think about new principles that have more teeth than IHP Plus had in the past, in terms of a new generation of development assistance for health. But again, I think we were positively surprised, and also about the fairly open conversations we had with the member countries.
That's very helpful. Thank you very much.
Thank you. Are there any other questions? Please feel free to unmute yourselves.
Hello, this is Cecilia. I work with Frontline AIDS in the United Kingdom. I just have a question about the discussions that you've picked up, and if you have any sense whether there is discussions about greater inclusion of populations that are always being left behind. And in my context is really people living with HIV, but within that is key populations, so those selling sex, those injecting drugs that are most often at higher risk of HIV acquisition, and in a normal playing field are excluded from mainstream health services. So even if we were to achieve UHC in any way, shape or form, there's still populations that are being left behind. So just in a sense to see whether those kinds of discussions are coming up in your discussions around UHC and health financing specifically. Thank you.
Anu, did you have a question?
Yeah, we got the.
Yeah, we did.
And I think it's a very, very good question. I think the conversation is really structured about the idea of frontline services and not in a passive way, but in an active outreach way to reach out to also the most vulnerable populations. It doesn't spell out specific target groups there, but I think that's the common understanding that is needed. And the focus in this conversation is naturally in terms of prevention and promotion, both for infectious and for non-communicable and communicable diseases. So it is in the agenda, but not explicitly spelled out which these groups are in the conversations that we have. But again, some of the members make it very explicit that they feel very strongly about aspects of not only solidarity and equity in the approach, but also leaving no one behind. So it's part of that conversation.
Great, thank you. We did get another question in the chat, if it's okay for me to read it out loud.
Yes, of course.
Great. My name is Liliana de Lima, and I'm the Executive Director of the International Association for Hospice and Palliative Care, an NGO dedicated to the development and promotion of palliative care for patients who are facing life-threatening and life-limiting conditions. The data shows that the risk of poverty is greatly increased at the end of life when patients are given many treatments. However, palliative care, with very few exceptions, is not included in financing mechanisms and funding agencies. Are there any suggestions on how we can better advocate for this so that the message from the funders and agencies is stronger and clearer about the need to include palliative care in UHC strategies?
Yeah, thanks for this suggestion. I think it's a very good one. Not that we have to admit that we have explicitly thought about this, but in particular about palliative care. But I think we can weave this into the story of the report. It's part of what we call building these systems that are fit for the 21st century. And these must be much more inclusive systems that we want to see. So we touch upon the issue of aging, we touch upon the issue of long-term care, and so it fits nicely into that storyline. So it's a very good suggestion. We will take it on board. It's a very good one. Of course, it's not, palliative care is not only limited to the elderly population, but also to people in the workforce, so in children. So that's a very good point. We will integrate this. And what the point that we make is that we see some kind of societal changes, even now in lower income countries, where the kind of social fabric is changing in terms of the role of the household in providing this kind of care. And we have some good examples, at least from long-term care in lower middle income countries, that there's a increased demand, and then actually opinion polls show that people expect governments to respond to this demand. So it fits very nicely into the storyline. So thanks for the suggestion. That's very helpful.
Great. Does anyone else have a question that they'd like to type in the chat, or you can unmute yourself as well? Okay, so I do have a question that just came up in the chat. She says, laryngitis apologies. My name is Karen Kaplan, and I'm a consultant to international NGOs. Are there new mechanisms or innovation avenues that would allow CSOs or CSEM members to engage directly with the World Bank and the Human Capital Project, given World Bank works directly with state actors?
So the answer is yes, there are. So the bank by itself has a civil society engagement platform at the corporate level. And so our overall mechanism as an institution is to work with civil society organizations through that. And I'm wondering if you're already kind of signed up to their activities. They do a few different things. They do a few things institutionally, which are they will do monthly outreach calls. They also do travel. So they do regional meetings. And so there are ways at a corporate level that the bank engages as an institution. In addition, there's also the regional vice presidencies also do similar CSO engagement. So I think the important thing would be to see depending on where you're located, what is available for you to be able to plug into. And then finally, from the point of view of the health practice, we do have our own CSO engagement as well that we do. We try to do something in person / on the phone every year at the spring and annual meetings where we share our own priorities. And that is something that we're trying to do this year at the spring meetings as well. And then we also get input into planned activities from CSOs, and we try to keep that as an open conversation. It is very difficult. I don't want to play down how hard it is, just given the distance and the challenges of working, and you all know that, even as part of the CSEM, plugging into a global organization or institution from afar. But we do try to do this at different levels. So maybe if you would like to email Eliana, she can forward your note to me, and I can come back to you on that with a separate note.
Yep, certainly. And I was going to say this in the end, I'll repeat it, but if you do have any of those kinds of inputs or questions or comments, you can always email them to the csem@msh.org email, which is the CSEM email that we have. I just typed it in the chat for people to jot it down. We do have another question in the chat, if that's okay, Anu. I didn't get a name. It's from MIT. So if you can just give me your name and organization at some point in the chat, that would be helpful. Could you please remind us of the timeline with main dates, example, when the report will be made available for further input and or final version?
Okay, yeah, that's very straightforward. So the first discussion, but only within the G20 Ministers of Finance of an early version of the report, is on April 10 and 11. The formal discussion is on June 8th at the Ministerial Finance Summit in Japan. Also, by then, this will be an internal document. But then on the eve of the summit, which is on June 27th, there will be an extra Ministerial Finance and Health meeting prior to the leaders meeting in Osaka, and this will be the time where the report will be made public.
Okay, and the question was from Mitt Phillips from MSF, just so you know.
Okay.
Does anybody else have any questions that they'd like to put in the chat? Again, please feel free to unmute yourselves if you'd like to speak.
I had a question, a couple of thoughts that we had from our side that I would like to also ask the group, which they're, feel free to either tell us now or, as Eliana said, email Eliana later.
Yeah, I think that would be great. We have 10 minutes left, so why don't you go ahead with that, Anu?
Yeah, so a couple of questions or points of feedback from us that we would love to hear from you. One is we're thinking through now what is the outreach strategy. As Christoph said, we wouldn't have the public report available till the end of June, but we would like to first of all, I would like to hear from you all what would be helpful apart from the report itself in terms of what's useful for your advocacy. We are thinking about producing a 2-page version of the report with all of the key highlights. We would want to get them translated at least into French and Spanish. But if there's demand somewhere else, we would love to hear that now for a different language as well. We won't be able to translate the whole report, but we do want to make sure that the key messages and the points that are most useful to you in your advocacy, which tends to be from bank reports data, as well as policy recommendations. So we will try to create a consumable version of this that would be helpful for advocacy purposes. We are thinking of producing a video that kind of highlights the key issues and why this is urgent, which hopefully will also be useful for advocacy. But if there are other ideas that you have for things that you think you wish a report like this would also produce as an add-on item so that it's actually useful to you, which maybe it's helpful at your country level for country level advocacy or other things, please let us know and we will certainly try and do that if we can. So that is one thing in terms of just feedback from you. And the other thing was, and maybe Eliana, you're already aware of this, is what are activities that CSOs are planning at the G20? Because there's going to be a large contingent of CSOs there. So we would love to know who is there. Would it be helpful for us to engage in some way so that this report is part of those conversations as well? That would be great to hear.
Thank you, Anu. And I just put up this slide so people can see our email address here as well for those that will be watching the recording. So you can always email your suggestions to this email and I can pass them along. Cecilia in the chat said that a French translation for the advocacy messaging would be useful for our partners in Francophone Africa. So I just wanted to highlight that, Anu.
We'll definitely do French and Spanish, because we try to do those by default, at least for a short version. So we will do that.
Great. Any other comments from the group?
Hi, it's Laura again. Just in relation to some of those kind of questions you asked, I just wondered if the CSEM or the World Bank team themselves are in conversation with the C20 group, which is coordinating kind of civil society around the G20.
Yep. So, Anu, if I can just chime in here,
Yes.
the CSEM is actually going to be hosting an event at the G20 for civil society. They're actually hosting a formal and informal event, from what I understand, and they're very much still in the design phase of it, but the CSEM will be promoting it in our newsletter and our website, as well as through our listserv, as soon as we get all the information from our advisory group member that will be there managing these events. So UHC 2030 has given us some funding to give a pretty big space to civil society, where we will discuss this and other UHC topics. So for those of you who aren't members of the CSEM, if you're interested in receiving this type of information, please visit our website at cscmonline.net. It's right here, and you can join. It's just a quick questionnaire that we ask you to fill out, and we add you to the listserv, so you can get more information on the activities that we'll be leading in the G20.
So Eliana, do you have a sense of when those events might be yet, or do you not have dates yet?
I would have to check with our advisory group member who's managing all of this, but all that information will be shared at once through the listserv once we have it all confirmed. Okay. Yeah. So again, great to join the CSEM if you haven't, because we do share that information, and of course we'll share it with you, Anu, so you can share it with your networks as well.
Okay. And again, if there's any way that we can productively engage or bring the report to the discussion or join a panel or whatever, we're happy to do that.
Yeah, that will be great. I probably, I think as a next step, we'll put you in touch with our advisory group member that's managing all of this, because I think it would be great to incorporate this if it fits in their agenda.
Yeah. All right.
Any other comments from the group? Okay, great. So as I've said, if you think of something later on, please feel free to email us, and I'll pass your messages along to the World Bank team so they can get in touch with you with answers. The other thing I would just like to say is we're recording this webinar. We had over 50 organizations register, but we know that people are very busy and sometimes can't join, even if they've registered. So just know that we're going to be sending the recording and the presentation directly to all the organizations that registered. And then if you are a CSEM member, we're going to be posting this recording and the presentation on our website, and we'll be sharing it also through our listserv. So please, if you receive the presentation and you know of people or networks that would be interested in learning more about this and hearing the presentation, please feel free to forward it. I do want to thank Anu and Christoph for giving us this great presentation. I think it was incredibly informative, so thank you for taking the time to do that.
Sure. Very happy to. Thank you all for joining.
Okay.
And we look forward to working with you more on this agenda.
Yes, most definitely. With that, I'll go ahead and close the webinar. Thank you, everybody. Have a good evening, morning, rest of your day.
Thank you.
Thank you very much. Bye-bye.
Bye-bye.